Monty, you have been so instrumental in kind of pointing me in the right direction. And
it was about looking at your character defects in spirituality.
It's the integration of clinical practices with the 12 steps.
It's an absolute pleasure. He certainly knows a lot of people. He's got a lot of energy, and sometimes when you don't have so much energy, he picks you up and carries you.
Having the Monty Man there certainly helps.
This is one of the places that is about the business of the solution.
The views expressed on this special broadcast of the Take 12 radio show do not necessarily reflect those of KHLT Recovery Broadcasting or its affiliates. KHLT is not affiliated with any particular 12-step fellowship.
Now here's that guy who's getting less popular minute by minute. Your host, the Multi-Man.
Really? Really? I've heard that is true. I've heard that I am getting less popular minute by minute, and some of the reasons for that is because I believe that I am right. 1% of the time, anyway. The other 99% of the time is still out. The jury's still out on that. Welcome, folks, to Take12Radio.com on your internet dial. I, of course, am the Monty Man, your host for the next hour, here broadcasting from the studios of KHLT Recovery Broadcasting on the outskirts of beautiful downtown Albany, Oregon. And I want to say again, I cannot say this enough. Please check out the Recovery Cartoon Caption Contest here at Take12Radio.com. If you go to our website at Take12Radio.com, you heard me say that over and over again all the time because I want it to sink into your brains, and click on Recovery Cartoons. And there you will find a cartoon for every month here since, I think, last September. They all have captions except for this month's cartoon. It does not have a caption. That's where you come in. And you can enter the contest, decide what you think is a good caption. It can be sad, it can be serious, it can be funny. We know all those things around recovery, and so just because it's a cartoon doesn't have to be funny. And read the rules. It's really, I know we hate reading rules, but you need to know how to enter the contest. And then every month on the Open Forum Wednesday show, sometime during the month, we will announce the winner for that month's Recovery Cartoon Caption Contest. And you will receive, this year, Mark Lundholm, internationally known recovery comedian, is sponsoring the contest. And the prize is, there's actually two prizes. The the DVD live Addiction, a Comedy of Substance, and then a bonus CD called How Is That Funny? Both presentations of Mark Lundholm. And we thank him, and we're so grateful that he's on our advisory board and is doing all that he's doing. Hey, listen, coming up, and we don't have, we actually do have a place, we do have the venue for this. I just can't say where it is yet, but it's a wonderful location. Coming up sometime this year will be a presentation by Mark Lundholm. He's putting on a show to raise awareness and support for Take 12 Radio. And he could be coming to a city near you. Actually, we're going to be doing it in 2 cities in the United States. So we're really looking forward to that, be looking for that. All right, today on the show I have 2 folks in the studio, and I'm so glad they both drove down here from Portland, from Portland, right? You guys, okay, to do this. It's one thing to do an interview over the phone. It's totally a different, thing when you're doing it in the studio. It's so much better. It's so much nicer. And so Lori Monday is here, and she is the wife of James Conway. And we're going to be talking about what these folks do, what they've got their hands in the middle of. Of course, we're all about recovery all the time. And this is very interesting because this is a field that when I was in ministry, I thought about this a lot. And this has to do, and I'll give you an example. Years ago, everybody remembers the Jimmy Swaggart debacle and what happened there. And it moved me. I really thought, who is there for people in leadership? I don't care if it's ministry. I don't care if it's retail. I don't care if it's drug and alcohol counseling or treatment. Who is there for leadership when leadership takes a tumble? And what happens? How do we restore people gently but with a firm hand? How do we do that? Is there anybody out there that can help with that kind of issue? And so we're going to be talking about some of that today. So let me tell you a little bit. I don't have Lori's bio with me, so Lori, you're going to have to help me out a little bit on you. Okay.
Glad to, Monty.
All right. But let me tell you a little bit about Jim. One of Los Angeles' most respected names in the field of chemical dependency, Jim has worked in the public and private sectors since 1972. He has formulated and directed hospital programs, both inpatient and outpatient, as well as freestanding day treatment centers. For more than 30 years, he has served as the program coordinator and senior lecturer for the UCLA Extension Alcohol and Drug Counselor Certificate Program. Jim has been passionately involved with various state diversion and health professionals programs since 1990, when he was asked to serve as the dental board of the dental board of the state of California as a member of the Diversions Evaluation Committee. In 1996, he was approached by the Physicians Diversions Program of the Medical Board of California and asked to facilitate its first health support group for physicians and mental health problems. He is the founder and chairman of Pacific Assistance Group, and we're going to be talking about who that is, what they do. Welcome, Jim, to Take 12 Radio. Thanks for being here, man.
Oh, thank you so much for having me, Monty.
Absolutely. Now, Lori, you keep this guy in line, right?
Hardly.
But I have to acknowledge and thank her for writing that bio. It's much better than I would have written.
But before we talk to you, Jim, let's talk to Lori just for a minute. What is your history in this area, if any?
Well, hi, Monty. I'm basically along for the ride today, so thank you for including me. I'm a licensed psychotherapist. I've been licensed for close to 25 years, and I have taught in the drug and alcohol certificate program at UCLA Extension for many years. Jim and I have co-taught a class for many years.
Right.
And I am what I like to refer to as a second stage recovery-oriented psychotherapist. So I do individual family, group, and couples psychotherapy, but my specialty is working with people in recovery. These are people who know how to be clean and sober. They've got all that down, but maybe they're still plagued with the same problems they had before they entered recovery. That stuff doesn't magically go away, as we all know. So when they're ready, I like to look at those things, but look at them through a lens of recovery and help them work out their longer term issues, including family of origin and, how we get to how we are now and how to quit repeating the same destructive patterns.
Sure. And we talk about this a lot on the show that narcotics, alcohol, food, overspending, sex, inappropriate sexual behaviors, and so forth, is simply an outward manifestation of an inward condition. And those are the symptoms. But in many cases, those were the solution, not the problem.
Yeah.
Right?
Absolutely.
Yeah.
Absolutely.
Yeah. And so there's kind of two schools of thought. One is if you separate the individual from the substance or the behavior, then everything's okay. The other school of thought, of course, is that that's not enough. And you touched on it, Laura. You said there's other things going on.
Absolutely.
Maybe even before anybody ever took the first drug, pulled the first arm on the one-armed bandit or whatever. Yeah.
That's right.
Yeah. And you've been in radio.
I have been in radio. I was on what I think was maybe one of the very first cable radio networks, called Cable Radio Network in Southern California, and I had a talk show. It was kind of an advice show. I considered myself kind of the healthy Dr. Lori. No offense out there.
Yeah.
But I answered people's questions, had guests, and kind of advice dispensed, how-to stuff.
So I have a colleague here in more ways than one with both you guys. This is great. What fun. And you guys have been married how long?
18 years.
Yeah. And in that 18 years, what have you learned about him that you didn't know before you met him?
Oh, Lord.
That really stands out.
Well, we married pretty quickly after we met. We did all the things we would have been horrified had a client told us they were going to do these things.
Yeah.
What if I learned? I'm going to have to take a moment to think about it.
Okay.
And why don't you chat with Jim for a minute?
Jim, what have you learned about Lori that particularly stands out since you've been married?
Well, part of it is just the qualitative aspect of being close to somebody and in love with somebody for so many years. You just learn more and more and more as time goes on. Mm-hmm. You see their depth. You see their, all their abilities that you couldn't have possibly seen in the heated first stage, of the relationship process. Mm-hmm. And, it's really been wonderful. I mean, I got a lot of love and respect for this woman, and it just continues to grow and grow.
Nice. He gets kudos for that, right?
Someone gets a good dinner tonight.
There you go.
Although he's usually the one who cooks, but...
Have you had a minute to think about it?
I have. And I'm going to say something that I hope you won't take the wrong way, honey, but I'm going to say it in a general way. That I have found that the thing that attracted me the most over time can also become the thing that drives me craziest. Does that make sense to you guys?
That. Absolutely. Yeah, my wife would attest to that.
but Jim's generosity of spirit, his nurturance, his caretaking, all these things that drew me in have at times, darling, made me crazy, but we always work through it.
Yeah, that's the important thing, right? Yeah. Never let the sun go down on your anger, that kind of thing. Talk through it.
And I think it's vice versa with him. Yeah. I'm sure that thing that attracted him to me is the thing that makes him want to put his fist through a brick wall sometimes.
You go, what was I thinking? Well, listen, we're gonna take our first break. When we come back, let's talk about Jim, what you do, the Pacific Assistance Group, and what that's all about. And listen, listeners, when I speak in front of audiences live, one of the questions I ask is, how many in this audience, if you feel bold enough to do so, would raise their hand and say that you've been afflicted by some kind of controlling behavior, substance, whatever, i.e. drugs, narcotics, alcohol, food, whatever. And several hands will go up. And then I asked the question, how many here, keep your hands up, how many here would say that you've been affected by those things? And then just about 70, 80% of the crowd, their hands will go up. And then I asked, how many people here know somebody and they love somebody and are concerned about somebody who is either afflicted or affected? And the rest of the hands go up. The number one health issue in our country, addiction. And yes, it's a broad term. But it's a broad crisis, and we're going to be talking about people that are afflicted and affected, and accountability. Really, right, Jim? I mean, there's a big accountability thing with what you do.
Of course.
Yeah, you bet. So, folks, don't go away. We'll be right back.
As men and women who have recovered from utterly hopeless states of addiction ourselves, we know all too well what it's like to battle addiction daily. We are Origins Recovery Centers. Here at Origins, we have taken that which we have learned along the way, excised anything unhelpful and unnecessary, infused it with the latest medical research and innovative therapeutic methods, and created what we know to be the absolute gold standard in substance abuse treatment. And Origins provides the most preeminent aftercare and relapse prevention program available in the United States. For a free confidential clinical assessment, call toll-free 888-843-8935. That's 888-843-8935. Origins, delivering real solutions for real families.
This is Chris Schroeder. You are listening to Take12Radio.com, recovery talk and positive music.
And welcome back. Jim and Lori are here, Jim Conway and Lori Monday. I love your last name, Lori.
Thanks.
I think that's awesome. And I mean, growing up, did you get razzed with that? Or, I mean, how does somebody razz somebody with that name? Mm-hmm. I mean, that's so cool.
Well, You can razz about anything.
I
pretty
guess
much,
you
can't
could. I guess you could. But it's just so neat. So Lori and Jim are here. Jim, what is the Pacific Assistance Group, and what role do you play?
Okay, the Pacific Assistance Group was formed in California after the closure of the Medical Board of California's Physician Diversion Program. And this was a program that allowed physicians who, because of alcohol or substance or mental health issues, had come to the attention of the board. And it was devised as a diversion idea is basically, let's do something other than pure consequence and discipline.
Mm-hmm.
Let's give people another option. Let's give them the option to enter and maintain recovery in such a way that they would no longer be a concern to their health professional licensing board. And, that over the years has got politicized by a group of attorneys who said, no, the only way that the board should be involved is to punish, period. And and ultimately they won. But when they won, there was set up in California a whole network of people who did this work, were very committed to doing the work. And we got together and we said, well, if we were not being supported by the medical board, let's do it privately. So we maintained our affiliation, did it privately, and we literally started with nothing. I mean, we had no outside funding, no outside support. It was just us. And we've grown. We did this in 2007. Here it is, 2014. And we've grown and grown and grown and established a good track record for doing what is essentially early intervention and monitored recovery. So historically, with health professionals, it was denial, institutionalized denial because of consequences. Medical board took the point of view, if you were diagnosed as alcoholic, you should lose your license, period. Didn't matter.
Right.
That's a big word, alcoholism.
Yeah. Sure is.
It can mean the guy we'd see living under Burnside Bridge, or it could be any of us.
You bet.
The best and the brightest.
So what they were really saying was, if you're actively drinking, if you're alcoholic, is that what they were saying?
No, they were saying if you had that diagnosis,
you weren't drinking, even if you were sober,
that alone would be enough to pull your ticket.
Wow.
So what this created, Monty, was a lot of hiding. Here's a good doc. Love this doc. They do good work. They're excellent. They couldn't be alcoholic. It must be wrong. That label must not be right, because they're not living under the bridge, the Burnside Bridge. So that created the idea that only in the most extreme case would you apply that label. So what that then did was created a huge institutional enabling system. And I had all kinds of examples of that when I came into the field in the 70s and in the 80s. I first worked in a public sector public hospital that had a very, very excellent alcoholism unit run by a pioneer in the field. And we would get we called our patients the cream of Skid Row. People with a potential for rehabilitation, but pretty late stage. And every so often we'd get somebody whose nickname was Doc. And after a while, I knew what the story was going to be. Doc got that nickname because he once was a doc.
Right.
And he had, contributed his community to his profession, but his alcoholism was allowed to progress until something horrible happened. An error of judgment or, a negligent act related to the illness itself. And then the roof fell in, lost everything, family, social standing, criminal prosecution, and was just literally out in the street living in the weeds. just like that.
Yeah.
Well, when we look at that, my God, that's at the end of decades.
Sure.
So these intervention programs are saying, let's get it early.
Let's raise the bottom.
Let's raise the bottom. Let's leverage the interaction. Look at, you can't continue to progress in this way. You are showing signs that in time will become risky to patients.
Mm-hmm. Mm-hmm.
So we're not going to wait till that. We're going to intervene early. And once you're launched into recovery, we're going to monitor that process. One of the key elements in the research of recovery is the longer you stay involved, the better you are.
Sure, you bet.
Somebody who says, I'm going to go to the magic 28-day program and that's it, has little chance beyond just stopping on your own.
Right.
But if there's some way of keeping somebody involved for 3 to 5 years, then your recovery, your long-term recovery rate, quality of life, contribution, give back to the community is going to increase tremendously.
Well, this is my question here. The people in the medical profession, the hierarchy, so to speak, the ones that said, this is what's going on, you're out of here. They know, with their own admission, that there is a ton of people out there. What, 1 in 5 crosses that line? Okay, out there that aren't reporting that they're alcoholic, that aren't reporting that they've got a problem with addiction, and they're practicing. How do they justify, okay, the guy that's stepping forward and saying, this is the deal, and this is what I'm working on, and my life's changing, how do they justify throwing him out when they know there's a whole bunch of people that are being silent?
Well, it's interesting, Monty. It's sort of a variation of the don't ask, don't tell. As long as, you're in that licensing hierarchy or institutional hierarchy, and I don't know about you, then we're fine.
Even if you're a brain surgeon.
Oh, sure.
Yeah.
Yeah. Actually, no brain surgeons. It's an equal opportunity illness.
Yeah.
It doesn't care if you're a brain surgeon.
It doesn't. But what I'm saying is, if I don't know about what's going on with you, then it's just so dangerous. I don't know anything that's going on with you, and so you go ahead and here's your license and go operate on people, but I don't want to know.
And part B is, if I do know, I'm going to come down on you hard.
Yeah, right.
And I think there's a part C. Excuse me for
absolutely,
butting my beak in here. I think overall physicians are woefully inadequately trained in chemical dependency and substance abuse. It's pathetic.
Was it 10 hours or something like that required through your whole medical school?
That would be good.
Is that good? Okay.
On the continuum, that would be on the good side of the continuum. When you consider that a majority of acute hospital admissions are related to alcohol and drug abuse in some way.
Yeah.
But the idea that doctors via medical training would understand this disease, which is a very unique disease.
Yeah, you bet.
It's medical, it's psychological, it's psychiatric, it's family, it's spiritual. That's a very holistic view. If you have an organ view, I'm an eye doctor, so if your eye's okay, the rest of you must be okay. Then I don't catch it.
Right.
So, and the environments reflect, the medical environments reflect the society's wrestling with this. Do we call it bad behavior? Do we call it an illness? That's been here in American history since day one.
You bet.
And a lot of times, like in an emergency room, he's an alcoholic. That changes the view of the patient. So, and it doesn't change it in a positive way unless you got some recovering health professionals in that emergency room who are saying, this is a patient, they deserve our best care, and we need to give them some special expertise about dealing with that. Just connecting the dots.
To play devil's advocate here, I kind of get, though, why so many people in the medical profession and the emergency room, especially the emergency room level, are saying, well, here comes Joe again.
Yes.
He's going to be puking on our shoes. We're going to have him in here for 2 to 3 hours.
He's going to be loud and obnoxious.
He's not going to pay his bill, and then we're going to see him again next week.
That's right.
We're sick and tired of this.
Yeah.
So I get it.
Yeah.
But at the same time, where's the compassion? Where's the...
Well, again, if I treat you incorrectly and you don't get better, do I blame you or do I alter the way I treat you?
Exactly.
And all too often, it's like, oh God, here he comes again. The word is a frequent flyer.
Yeah.
But you can have very effective interventions at that level. And like I say, they're not complex. If you articulate the diagnosis to the patient, connect the dots.
Right.
Here's your medical problem that brings you here. Here's how it's related to drugs and alcohol.
Yeah.
You may think, well, that didn't turn him around. It has a role, though. It's a piece. It's a part of the process of turning somebody around. Because a lot of times, and especially from my background, ran hospital programs for years in large medical centers. I would have charts literally a foot thick of people treating the medical consequences of alcoholism and not looking at the alcoholism at all.
Right.
So are they going to get better? No.
Right.
If their medical consequences are because of this problem, you don't treat this problem, the big one, the big elephant in the living room, it's just going to repeat.
One of my frustrations, and I know a lot of folks share this, is in many treatment facilities, we have the clinical view and the clinical treatment without the spiritual. And then there are some where we have the spiritual treatment, but without the clinical. And I'm not going to say which organizations right now, but people know who I'm talking about. Some know what I'm talking about. It's almost like there is a body of folks on the clinical side that they understand the problem, but they don't understand the solution. And then you have the faith community many times that understand the solution, but haven't got a clue about the problem.
Sure.
And things like the CORE conference that C4 puts on is in Cape Cod and so forth is helping to bridge that gap. Do you see that getting better?
Well, like I said, I came into the field in '72.
Yeah.
And I was mentored by a pioneer physician named Vicki Fox out of Atlanta, Georgia. And what she beat into us was the idea of the interdisciplinary team, which for her always included clinical chaplains. So
interesting.
So in the conferences, in the case conferences, there was always the point of view and the input from the clinical chaplain. We had our, I'm a marriage family therapist, so I'm going to come in from the clinical end, doctors, addictionologists, addiction psychiatry, nursing, counseling, all of that. But that, to really do it, to really launch it effectively, the better programs integrate those two. Yes.
Laura, do you think it's getting better? You think that the solution and the problem are starting to come together and people are starting to see that?
Oh, Lordy, I hope so.
Yeah.
I can't really speak to that because there are just so many treatment programs all over the country. And coming from Southern California, the land of the dueling banjos of competitive high-end, Malibu will massage your dog for you while, you're getting your acupuncture and will, grow our own lavender for your own potpourri.
How can somebody launch recovery without a Michelin chef on duty? How could they possibly do that?
I don't know. I guess they could do everything but their eating disorder that way.
Right.
But do you kind of get my drift of where I'm going? I think that's an impossible question to answer. Hopefully, I think one thing that the internet does and constant information 24/7 does is shed more light and create awareness. And I think anywhere there's more awareness, there's going to be more hope and more treatment.
Well, I think, Monty, what you raise in that position, in that question, is valuable for people out there who are hearing this and who may be struggling with, how would I know if I'm trying to get my son or daughter or spouse into a good program? Well, all you have to do is ask in that phone interview, does this program integrate the spiritual approach to recovery with the medical, the psychological, all of that? And any good program should be able to come up with a really good answer to that.
You bet. Without hemming and hawing,
yes.
And trying to sidestep it. Okay, so the black cloud that is hovering above all of this is stigma, right? I sat in on a board meeting for C4 Recovery Solutions. There was probably 30 people, and the question was asked by Rick Orstrom, the CEO there. He said, "What do you guys think of stigma? Is it getting better?" And several people chimed in and said they thought it was, and it was really easy to get on that bandwagon. And then Rick said something that blew me out of the water. He goes, "It's not." Because, there's Facebook. There's a ton of different social. There's LinkedIn. There's Google Plus. There's all these things. But we're talking to each other.
Yeah, right. We're preaching to the choir.
Yeah.
There's less stigma in our field, right?
Yeah, and so now we're talking. It was what you do. We're talking about stigma plus, because you have a professional that is living with, perhaps successfully, in a state of recovered from a seemingly hopeless state of mind and body, but it still has the allergy of the body. If he puts alcohol into his system or narcotics into his system, boom, he's off to the races. So the stigma on them is just, it's just intense. So you've got these guys that are working in the field, particularly. I mean, we talk about medical doctors too, but what about drug and alcohol counselors? What about people that are doing psychotherapy? People that are doing what do you call it? There's even some acupuncture evidence that helps and things like that. They're in this field and they're looked up at too, and then somebody finds out that they are actively participating in the behavior that they are treating. Okay. Who comes to you? Who comes to the Pacific Assistance Group and says, "What can we do?" I mean, is it them?
Well, what I get in terms of who makes the call.
Right.
I get the health professionals. Some, once they know that there's an answer other than just hiding and getting worse or trying to do it as a do-it-yourself project. I get the institutions that have a reasonable point of view of, let's get this person help before we deal with all the consequences here.
Sure.
So I have enlightened institutions, I have unenlightened, and in California I would get a lot of calls from a group of attorneys that are called healthcare attorneys. These are attorneys who represent health professionals in board interactions. Sometimes it takes the board's a healthcare licensing board coming into the picture for the light to go on. And then because that takes a long process, a due process, then they have a chance to engage and demonstrate recovery so that the board will take a view toward them that isn't just about, do we choose between the gallows or the guillotine?
So what is your sense that patients of these folks think about this whole thing about not yanking their license but helping them?
Well, it's interesting. Their patients tend to really like them, especially if you catch them early. They're dedicated professionals. They're engaged with patient care. They're there for all the right reasons. They just got a disease, and it's in an early stage.
Right.
Because I would always, in the internet age, when I'd get a new doc, I'd go to the health grades, the Yelps, and all the patient they were all, I had none that had complaints at that level against them. None at all.
That's awesome.
When, as their recovery would continue, and I've often said this in public and private situations, is when I think of myself, and if I had a certain disease, I'd want to go to one of my docs. When I know they're in recovery.
Yeah.
I know they're not in the process somewhere. And I've heard them really speak of and exemplify their dedication to their patients.
Yeah.
And also, American trained doctors are really, really well trained. When you go through the, various state disciplinary records, and I do that because they're all very accessible. When I see the American trained doctors, there's rarely an issue of negligence or incompetence connected with what got them in trouble.
Versus European doctors, or
foreign trained doctors. To me, I'm just going to have a higher chance of seeing some implications of negligence or incompetence.
Really,
and I don't. I can't really make that statement go any farther because it's
I understand.
Based on my interest in my looking at that sort of stuff. But what's fascinated me is how high their patient scores are.
That's interesting.
They are loved and appreciated generally. I've certainly had ones where they say I had to wait in the waiting room too long. In that level of, or I didn't like the person at the front desk.
Yeah.
But the medical care, excellent.
Yeah,
excellent.
Okay, we're going to take our second break here, and I want to come back and talk about the mechanics of this thing, how this actually works, the accountability.
Sure.
What happens when the person comes under the directions and the healthy boundaries that you guys put in place? Don't go away. More with Jim Conway and his wonderful wife, Lori Monday, here at Take12Radio.com. Recovery talk and positive music.
Men, women, and their families experience tremendous pain and suffering due to the struggles they face from substance abuse and its co-occurring mental health challenges. They need to find a safe place for peace and healing. Therapia Addiction Healing Center was born out of a deep desire to provide that safe and powerful healing environment. Therapia exists to help people recover from addictions by developing and maintaining healthy, meaningful relationships with God, self, and others. To speak with an addiction specialist, call 1-855-652-4325. That's 1-855-652-4325. Or visit our website at www.therapia.net. Therapia Addiction Healing Center, restoring lives one step at a time.
Let's walk through the big book. Join Chris Schroeder and the Monty Man for this in-depth journey through the basic text of Alcoholics Anonymous. As one of the most sought-after circuit speakers in the world of the 12 steps, Chris will be walking us through line by line, page by page, of this wonderful book that has meant so much to so many people who have recovered from the disease of alcoholism. If you've never studied the big book, or even if you have but would like a new, refreshing approach, join us here at Take12Radio.com for an exciting, educational, and spiritual look into a plan for living that can be applied and implemented into the lives of anyone who is willing to recover from alcoholism.
And great news, my friends, you can now get that entire series, 34 one-hour workshops. You can get it for free. Download it here at Take12Radio.com and click on over to the left-hand side on the main page. You'll see our workshops, and walking through the big book, click on the little icon there, and you can listen online or you can download the MP3 of each and every one of those workshops, and we offer that to you for free. If you would like the DVD, the audio DVD, we would appreciate a donation of $25 for that, and we'll be glad to send that out to you. And there's a place where you can go on our recovery store on the website to pick that up. But we felt it was absolutely essential that we make that available to you. It's the most comprehensive workshop ever recorded on the study of the Big Book of Alcoholics Anonymous. We didn't want anybody to go without it. So there it is there for you for free. Also, for free, and you can download the MP3s on all the workshops on walking through the 12 steps and 12 traditions with Chris Schroeder. Directly under that one. So we got a ton of stuff for you there for free, for fun and for free. All right. James Conway and Lori Monday, both in the studio with me. Jim is a part of the Pacific Assistance Group, and this is an organization that helps people get better, through accountability. So let's look at the mechanics of this. So-and-so calls you, whether it's the individual themselves or an organization that is concerned. Mm-hmm. Take us through the process.
Thank you. I'd love to do that.
Yeah.
Because I think even though this comes out of working with health professionals, it really is a model of good intervention and recovery monitoring for the public. To me, it's like this is nothing unique. It's high quality,
right,
long-term care. So, if that person comes in, first of all, I want to know where they are on the spectrum of substance abuse. Do they need, to be in a medical supervised facility? Do they need to be shepherded in to 12-step without formal treatment? I want to know where they are along there.
Yeah.
So I want to do a good, what we call a diagnostic evaluation. I don't do that myself. I have somebody do it.
Right.
So, I'll have, like here in Oregon, I'll use a facility like Serenity Lane or Hazelden or one of those that are involved with health professionals. And I'll get a good solid evaluation so I know what I'm monitoring. And then once they're monitored, once they're launched into recovery, then that accountability part, drug testing. So I want to be able to call them anytime, ask them to test, and get a comfortable response, which already tells me what the result is going to be.
Yeah, you can tell.
Sure, I don't mind, because I've educated them. This is not meant to be an intrusion. This is meant for you to be able to say, and me to vouch for you.
Yeah,
that you are clean and sober today.
This is a freeing thing. This thing frees you up. Yeah.
And then I also, because it's related to your practice as a health professional, I want to have input from where you work, your practice, your organization, your hospital, your clinic, so that they can call me and say, I'm concerned about Dr. Monty.
Yeah.
Okay, what's going on?
Yeah.
Is it a little concern? Is it a big concern? And here are the red lights. Here are the pink lights. Here are the let's debate it and modify things lights. So we can have that quick response to a small problem so it doesn't become a big problem. I like because, I think addiction is an equalizer. You get addiction, you're addicted, you're just like every other addict.
Mm-hmm.
On the other hand, culturally, you may have some differences in how you launch recovery and what helps you maintain recovery.
Right.
So I will have then also what are called facilitated peer support groups. I'll have basically modified group therapy with health professionals so that supports their recovery, so that their interaction with each other is supportive. Because a lot of times when health professionals go into civilian recovery, and I'll make an artificial distinction there with that word, but they encounter the same biases. You're a doctor, you ought to know.
Right.
Or, I got a beef against my doctor, and I'll express that to you as if you did it to me. But again, that view that you shouldn't have gotten in trouble with this because you're a doctor. You should know.
Yeah, you should know better. Right. You should know better.
Yeah. Right.
Yeah. You should know better than to get cancer.
That's right. Exactly. You shouldn't have diabetes. So then you put those elements together, and these are very common elements in what are called physician health programs, professional health programs throughout the country. There's a national organization called the Federation of State Physician Health Programs,
Mm-hmm.
another one called the National Organization for Alternative Programs, or NOAP. And again, same model.
Right.
That if you intervene early, that if you have a tight monitoring process, and then are supportive. And a lot of the programs now are neglecting that part, being supportive. It's just accountability. It's, here's what you got to do so we don't slap your hand. But with all of those things, you got a very, very high recovery rate.
Yeah.
I mean, most recovery and relapse, research and evidence would say most people relapse in the course of their recovery. Yeah, no problem. I understand that. It's a relapsing disease.
True.
I want to get the relapse when it's an inch high rather than 10 feet high. I want to catch it early so that loss of control that goes along with the relapse doesn't affect other vulnerable people. So by the monitoring, by doing all of these things, we'll have our relapses in there. We'll catch them early. We'll intervene. We'll do solid interventions and get them back on track.
We know that there are a couple of kinds of folks that partake in mind-altering substances. One is the heavy drinker or the narcotic abuser that simply needs to grow up. They're just maybe something will happen. Maybe they'll get a DUI. We all know you can get a DUI and not be an alcoholic.
Right.
Maybe their wife or their husband says, "This is it, no more," and it's it, no more. They grow up, or maybe they get confronted with their employer, and they just knock it off.
Yep.
Then you have the person that has the allergy of the body and the obsession of the mind, the real deal. The person that, regardless of the consequences, just cannot put that plug in the jug.
Sure.
They can't go to 90 meetings in 90 days, put the plug in the jug, and read the steps on the wall, and become a productive member of society. They can't. They have the disease. They have the illness. One of the things that tends to concern me a lot is that within our prospective recovery circles, we don't qualify people like they used to, where we actually sit down and ask them some questions and say, because, there's these forms you fill out at treatment centers, right, to determine whether you're an addict or an alcoholic. Yeah. And if you take any of those questions, most of the time, any of those questions could be answered yes by a heavy drinker or a narcotic abuser, but not the real deal. How do you qualify? Do you when you work with somebody that's in the field, the doctor or whatever, to find out if they're actually have this illness or if they just need to grow up?
Well, it's interesting because what I would look at, and I have health professionals who got in trouble. I had a heart surgeon who had a bad day. In the middle of the day, he went out and had a drink, came back to the hospital, and he smelled of alcohol.
Yeah.
And they had a big reaction to that. I monitored him for 4 years. He wasn't alcoholic.
Right.
But he needed that information, and he needed what happened to really take it seriously. That, like the one-time DUI person. It's not a pleasant experience. It's expensive. It's embarrassing.
Yeah.
And so a lot of, if you don't have the disease, then the consequences are good for life.
Yeah, it seems to be that way.
And you also have maturing out. You have people who at a different stage in their life can get in trouble with something. I came into the field in 72. I'd come out of the Army. I worked with Vietnam veterans, and had a lot of them who smoked heroin in Vietnam. That was, for $2 you could get a pack of Luckies laced with heroin, and it was high grade, Golden Triangle heroin, and they smoked it a lot. They smoked it addictively. When they came back from their tours, they stopped.
Yeah.
High percentage. Some didn't.
Yeah, some didn't.
But a huge percentage did. So, you get, when you do the assessment, if you do an honest assessment, and the treatment field over the years has gotten in trouble for not doing honest assessments. The idea, the diagnosis is you came in, to the treatment center and had an interview and you had health insurance. That means you were diagnosable. That's not a diagnosis. That's not an accurate.
Lori's shaking her head. Yeah,
but that's called "What's our dollar doing in your pocket?"
Right. Yeah. So, when I work with health professionals, I want to know that. I want to know because I see it all. I see the full spectrum.
Right.
Right. Clear. But again, you can make a clear diagnostic.
Right.
Evaluation. A lot of times there's pressure to do it in a 1 hour, 3 hour, or 3 day evaluation process. That's hard. That's hard to really have trustworthy results. But if I've got them for 3 years, I'm confident. So I can say clearly to that doctor who came in and smelled of alcohol, you're not alcoholic, but you really needed to take that seriously.
You bet. Jim, who do you report to? I mean,
in each case, we develop, and because we're a private organization, we develop somebody that we call the concerned entity. Now that could be your spouse, that could be your employer if you're an employed health professional, it could be your practice, it could be your licensing board or your health attorney. Your healthcare attorney doesn't want, wants to represent you well, but also wants to be there and support you not getting in more trouble.
Right.
So whenever I identify that concerned entity, I get the releases so I can talk to them, they can talk to me. So again, if there's a problem, let's catch the small one rather than the big one.
All right, here's the biggie. What's it cost?
Well,
because everybody's asking that right now.
Oh, sure.
This has got to have a fee to it. What is it?
Of course, it does. It does. So in my monitoring program, I would charge $400 a month for the monitoring, plus the testing. That doesn't go to me. That goes to the test lab. If there's treatment involved or required, then that's paid for separately.
Right.
So the one fee that I collect is the monitoring fee. And, now...
that's very reasonable, I think.
I think it is.
I mean,
it's a car
versus
payment.
the alternative.
Yeah.
Yeah.
So you don't buy that new car this 5 years.
Yeah.
Okay, that's good.
Yeah.
So it's not cost prohibitive. And if it is, I modify that. I get medical students, I get residents, interns. And again, they're the ones I want to get because that's the first time the problem has shown itself.
Yeah. So
I'll modify that easily. I don't have a problem.
What about, for lack of a better term, repeat offenders?
Well, I've had health professionals who went through the 5-year monitor recovery cycle 3 times. And at that point, they know I need lifetime monitoring. Because as long as I'm in monitoring, I live a good life, I live a happy life, I enjoy recovery. But as soon as I get out, that little part of my brain just starts getting more talkative, bigger, and I have a problem. So I come back in, and then they get to the point of saying, you know what, I need lifetime monitoring. I'll just do this. It's not an onerous process. If I'm testing, if there's a bad case result, if you practice medicine, you're going to have bad case results. If you do everything right.
Yeah.
If you read things like the Merck manual or diagnostic manuals, a lot of the outcomes of disease are not happy endings. So, if I have a bad case outcome, if anybody questions that, I want to be able to say, look at it, whatever it was, whatever you want to get on my case for, it wasn't the result of alcohol or drugs. So
gotcha.
We can get that off the table.
Pacific Assistance Group. Now, is this just located? I mean, is there an office?
There are many offices because we're a poor bunch of health practitioners. I'm the only one up in Oregon. I moved up to Oregon to look at the possibility of establishing this type of program here in this state.
Mhm.
So in California, we're statewide.
Oh, wow.
We don't have a central office.
Mm-hmm.
We have a website, but that looks actually pretty impressive. But it's it's simple, and we work out of our offices.
So does a person have to be a resident of like Oregon to utilize your services that are located in Oregon? I mean,
well, I've just relocated. We just relocated here in November,
right?
So I'm just trying to get to know everybody, get a feel for Oregon. Oregon has they have a PHP program, but to my point of view, it's very much consequence and leverage, and I want to set up something that is more supportive in nature. Includes that, but is not just that. So that's part of my mission here is to just try to see if that model can work here in some way.
You bet. You and I met at the Sober Portland networking event.
Yes.
And just to give a shameless plug for that, if you click on the Tuesday link at Take 12 Radio, you can hear the show that we do once a month, usually on location. And you and I met at that event. What was your experience with everybody there? I mean, because you got a lot of people in the field, right?
Yes.
That were there.
It was a wonderful experience. It was
Good.
great to see this whole Portland metro area, because it included Washington, all over the greater community, and the amount of cooperation, interest. I mean, I was welcomed, in a wonderful way. When a Californian a lot of times comes up here, we think, are they going to not like us? Are they going to say, turn your car around and drive south, go back there? And it wasn't that way at all. I mean, I just had so many good connections, like yourself. I mean, I got to meet you there because you were doing the field coverage right on the spot. So you were part of that, and I thought, oh, this is good because there's radio and media here. There's every kind of program, from the programs that are psychiatric and chemical dependency, faith-based, clinically based.
Right.
All of them were in the same place and really being good.
Yeah.
Playing well together.
Right.
And I thought, okay, this is something that's really for the good. I mean, I really think every community hub, every metro area should have events like this.
Yeah, I agree. You said something that stood out. You said everybody was playing well together.
Yes.
Let me ask you, Lori, in the field that you worked in, do you see people coming together more? The psychotherapists and the drug and alcohol counselors and the medical doctors, are they kind of jiving better with each other these days?
I think most definitely they're jiving better together. Jim and I, for I think almost 10 years together, and Jim for just probably 2 decades before that, we taught a class at UCLA in their drug and alcohol studies program. It's the part of the course material you take to become a KDAC. And we clearly noticed over the years the different people who would come take the class and be in. It's a 2-year program, I think, and it started when I first started with mostly people in recovery and a lot of people who had very little education but were really inspired and wanted to go back and give back and make their lives and their careers in that field. But over the years, we've seen PhDs come in, marriage and family therapists. We had a regional head of a huge hospital group that I'm not going to mention, but we have had some very a lot of celebrities.
Yeah.
It used to be like, who is our celebrity
Yes.
du jour here? Some better, some worse, for the wear. But it's definitely gotten more collaborative over the years. Definitely.
Yeah, you bet. You
no
bet.
question.
And that's a good deal. We have to stop this "it's us against them" thing. I mean, I'm not old enough in my own recovery journey to remember this, but I know just by reading the history on Alcoholics Anonymous, and there was a time when the medical community and the 12-step community were really bonded. You had Reverend Sam Shoemaker, you had Dr. Bob, you had Dr. Silkworth, and everybody was talking with each other. Then it kind of broke apart, and I think it's moving back together with things like the core conference and some of the what is the name? I'm searching here through my stuff.
Well, one organization, in that respect, you have the American Society of Addiction Medicine.
Yes,
you have residencies and fellowships in addictive medicine, where doctors who don't come from a personal background but have a strong interest in this area, and they can really learn that. Betty Ford Center in Rancho Mirage has a residency. UCLA has a residency. Oregon Health Sciences University is involved in this. So it's a way of both legitimizing this as an honorable area of practice, not just addiction medicine.
Oh, yeah.
That's for the losers.
Those guys.
Yeah.
U.S. Journals, who I was thinking of, U.S. Journal Training Corps. All right. The website is pacificassistancegroup.net, true?
That's correct.
Okay. And when folks go there, they can, if they're interested, if they want to talk to somebody about their loved one or about themselves.
Sure.
I need some accountability. Accountability worked before. Maybe it'll work again in a little different way. They can go to that website.
It has all our contact information on it via the internet or phone numbers. We're happy to do that. And again, we're focused on health professionals. That's kind of our little piece of the world of addiction and recovery.
Right. So we, if mom wants to get 16-year-old Johnny accountable, this may not be the program for her.
Right. But a lot of the programs are being imbued with this model. Like if you do adolescent treatment, one of the ways to reduce family friction around what's going on today, you institute a monitored, you introduce testing in a way that's everybody's okay with. Then Johnny can say, okay, Mom and Dad, you're wondering about my piercing my ear, whether it means I'm in a relapse. I'll pee for you. It doesn't matter. Or I'll put a test strip in my mouth, or I'll, use any of the other devices that are good. And it stops the heated discussion.
Yeah.
It just allows us to heal more naturally once that's off the table. So how can we get it off the table?
Accountability and support with leverage in the background.
Yeah. Love it.
Yeah.
Love it.
That's great.
It's a good combination.
We're out of time. Yes. This has been wonderful. If you know somebody that's in the medical profession that's in trouble, if you're in trouble, and if none of that applies, I still encourage you to go to pacificassistancegroup.net, because there may come a time when you will need this service. Your organization, yourself, and any last comments from either of you to our listeners today?
Well, I think media broadcasting like this is really, really helpful. When we look at the history and whether it's been viewed as an illness or misbehavior, media has really played into that.
Yes. Oh boy.
It's the celebrities who have good recovery, I think, are are really good. I like it that they can, be open since they're public figures anyway. They're, they look at whether they have a mole on their nose. Why not, also share about this? And I think the more that gets out there, the more that's available to the broad community, the specific community of people interested in recovery, or we got our new cultural and ethnic communities. We had in Southern California an Iranian network, and they had recovery programming in Farsi.
Wow.
That is wonderful. I think the more the better.
Yeah, you bet. Lori?
I want to say, like the good wife I am, everything he said, and thank you for having us, and thank you for doing what you do.
Yeah, really.
I think you provide such an amazing service and work to the world at large who listens to you. And out of all the things we've done in Oregon since we've been here such a short time, this really is way at the top of the list. Thank you so much, Monty.
I'm blushing.
I can see it.
He is so
red.
You
can't see it on the radio, but I can see it in the studio.
Red is red.
Well, it's been a pleasure to have you guys on. I'm so honored to meet you, Lori. And, things just go much better in life when we do them together, right?
Yeah, of course.
Yeah, you bet. You bet. All right. James Conway, the Pacific Assistance Group, his wife Lori Monday in the studio here at Take12Radio.com on your internet dial. Please visit PacificAssistanceGroup.net. Follow the links here at Take12Radio.com. And remember, my friends, do something now that will make the person you will be tomorrow proud to have been the person you are today. Until our next broadcast, this is the Monty Man along with Jim and Lori, and we're wishing God's perfect serenity for you.
This has been a broadcast of KHLT Recovery Broadcasting.
Kitty, 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 kitty.